Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us. The legislative debate over a hate crimes bill advocated by the governor once again underscored the political and cultural tensions the subject has always brought to the surface. And there's new concern that crimes motivated by race or religion or ethnicity, sexual orientation, those crimes are increasing. In a moment, two Arkansas academics who have long studied the issue. First, COVID-19 in Arkansas. If the trend lines have generally taken a more favorable trajectory of late, generally speaking, well, there still remains real concern that the state and the nation are lowering their guard. Case in point, the comparatively static percentage of Arkansans who have received the coronavirus vaccine, and the substantial number of their fellow citizens who decline it. Joining us now, Dr. Jennifer Delahaye of the Arkansas Department of Health and the state epidemiologist, and Ray Handley, president of the Arkansas Foundation for Medical Care. Thanks to both of you very much for being with us. Doctor, let's begin with you. Obviously, the statistics are better than they were this time a year ago, and certainly midsummer or even last autumn. But as the society is reopening, however gradually that might be, is that progress jeopardized?
Well, I think there is potential for that progress to be jeopardized, especially since we're now seeing the spread of some of the variants of concern in Arkansas. It makes it really important for people to be immunized with the vaccines to prevent the spread of those variants.
Well, elsewhere in the country, they've been offering everything, or at least proposing anyway, a beer shot or shots of Jimson's, I guess, and maybe a cold suds, and even cash payments to get people to take it. Our best arguments here seem to be working only moderately well. What's to do here?
Well, I think that there are a variety of approaches that we need in Arkansas. You know, many people simply need more information. They have questions or concerns about the vaccines and a way to get them addressed. So we're working with our healthcare providers around the state to be able to provide the vaccine and individually work with their patients to be able to address their concerns.
Yeah, Ray Handley, I'm sorry, go ahead, doctor.
Well, and then I think there's other people who just have difficulty accessing the vaccines. It's not important to them at this point in time because the rates are low. And if the vaccines can be made convenient to them, that may also help them get vaccinated.
Ray Handley, from your perspective.
It's a challenge, one I think that we can meet. At AFMC, we've been privileged to work for the health department on a variety of fronts on COVID for the last year, contact tracing, case investigation, running a call center, trying to get people to come in for their second shots, but most recently on the vaccination front. And we worked out an agreement last week with the health department where we're essentially going to do pop-up vaccine clinics around the state. We're going to show up at some events like Toad Suck Days, and we're going to try to go into some of the smaller areas, rural areas that have been more reluctant to set up and do some vaccinations. And we're mapping out a plan with the health department this week. We're going to start out tomorrow at the food court in the Central Mall in Fort Smith, and then we have a number of places we're going to be next week, trying to reach some of the people that have chosen not to be vaccinated before by, in essence, going on the road and taking the vaccine where they are. The
earliest instances of that, or efforts along those lines, Ray Handley, have not seemed to have proved very effective. Can they be? What's going to change?
It's going to take some education. I think the faith community, can and hopefully will do more. I think the governor's been, quite out there to talk about the goals. there's probably needs to be some media. There needs to be some, trusted figures get up and talk about this. And again, if we take this on the road out into some of the communities and make it more visible, I think that'll help. We were going great guns for a while. We had not enough vaccine, and more people wanted it that can get it. And now it's reversed. We've got a surplus of vaccine. The J&J news didn't help. I think that slowed us down. But we just have got to be out there and be visible, be seen, in some of the outlying communities.
Well, let me stay with Ray Hanley for just a second, as to follow up on Dr. Dillehay. What's involved here, Ray? The reluctance to take the vaccine, is it logistical, as Dr. Dillehay indicated, and in fact, in some rural areas, vaccine may be more difficult to access than in more urban areas, but also is there a political, a social, a cultural issue here that has to be overcome?
It is all of that. Certainly the Pfizer vaccine, which takes some special handling, has been a bit of a challenge in rural areas. I think there's a lot of misinformation out there. We can blame social media and talk radio for part of that. Right down to, people hearing and believing that you're going to get a Bill Gates microchip implanted in you if you get a vaccine. And we just have to keep sharing the facts and talking about the fact that, this vaccine is 95 to 100% effective and certainly proven safe around the world. And you have to look no further than what's going on in India now, which is devastated by COVID, a nation that only 2% is vaccinated, versus turning the corner here in the United States in very large part because of vaccinations. And we just have to get people to see that somehow, and it's going to take multiple points of contact and media and people talking about that to get some of this reluctance overcome. And it is more widespread, I think, in rural areas than it is, say, here in Little Rock, and that's where we're going to have to take this.
Yeah, Dr. Dillehay, to follow up on Ray Hanley now, talking about figures of authority anyway. The governor of Arkansas, why with a stunning re-election victory just recently, or a couple of years ago, has been on his knees practically every day since COVID was first heard of, begging Arkansans to follow the protocol and, of late, get the immunization. Yet still there's some resistance out there. If you could snap your fingers, what would happen? What would move this along?
I think one of the hard things is for people to know who they can trust. And there's so much misinformation out there and ways of looking at the safety and efficacy of the vaccines that people have a hard time sorting through that. So everyone needs someone they can go to that they trust to help them sort through the information that's real and accurate and what is not. So if I could snap my fingers, I would provide each person in Arkansas with someone they could talk to that they could trust about the vaccines for them to be able to make an informed decision.
I'm not aware of a family, you may be, I'm not aware of a family physician or general practitioner who isn't urging his patients and their families to get the injection. Is there something else that can be done beside that? Are we talking about political figures here, Dr. Dillehay?
No, it could be someone that they trust, but I think partly, the benefit of someone who's familiar with the vaccine is they can help the patient or the recipient know what's real and what's not, so they can decide for themselves what they need to do. Many people believe the misinformation out there because it sounds quite reasonable unless you know some biology or a little bit about how the vaccines were developed. And people who know that can help people sort through and clarify in their own minds the risks or the benefits of the vaccine.
And this also, there was a herd immunity we have heard, for months now, may be if there is such a thing as an ultimate answer, that herd immunity was the goal that frankly, the globe was aiming for. But some fairly disquieting headlines within the last 48, 72 hours from the scientific community, the medical community, indicating that that may be a fleeting hope. Could I have your assessment, Dr. Dillehay?
Yes. Well, COVID-19 is a new disease. We don't really know what proportion of the population needs to be immune in order to achieve herd immunity. And it could be that as the illness becomes endemic, meaning more common, like we get the flu every so often, or other coronaviruses that cause the common cold, that we won't ever get to the same kind of herd immunity that we do, say, with measles. Measles, it develops long-lasting, lifelong immunity if you get it, and the vaccine does the same. That is not the same with COVID-19. It's well documented that people can get it more than once, and we may not have lifelong immunity for most people for this virus. So the concept of herd immunity doesn't work so well in this setting. It really has to be people protecting themselves and their family by getting vaccinated, even though as a population, we may not be able to completely eradicate the illness.
The governor has a 90-day goal, announced a 90-day goal on immunization. I assume you support it. Is it realistic?
I think it is a worthy goal, and I do hope that we can achieve it. I think right now is an important time to get vaccinated. We have an increasing number of what we call variants of concern circulating in Arkansas. And every time someone gets infected with COVID-19, they assist in the spread and the development of variants. And we want people not to get infected, and the best way not to get infected, of course, is to get vaccinated. So we want people to take advantage of this and take it seriously so that we can stop even low level of spread, because right now, small things that we do in Arkansas can have big effect down the road, such as in the fall or the wintertime with COVID-19. So achieving a goal of vaccinating half the population, I think, is worthwhile, and I think we can do it.
Ray Hanley, a quick review of the numbers here, if I've got them down correctly. Since COVID was first diagnosed or identified in our state alone, about 340,000 Arkansans of our fellow Arkansans have been infected, and approaching 6,000 have died of it. It's pretty sobering numbers.
It is indeed, and we're just going to have to, I think, systematically stand up the reasons people are objecting and the misinformation and try to dispel these one by one. And one of the most frequent ones I've heard is, well, there's got to be something wrong with the vaccine. It was just developed too quickly. But as Dr. Dillehay knows, this is not new science. The RNA vaccines and the science, goes back years. These have been under development and on the shelf more or less for years. It's just that the companies were incentivized by money and to get them finished and rolled out. So we have to take things like that one by one and try to put down the misinformation. And as I said, that's one of the most frequent ones that I've heard, but there are certainly others out there.
I got to end it there because we're out of time. Ray Hanley and Dr. Dillehay, as always, thanks to both of you for coming on. We'll see you again soon. From simple, if stupid, harassment to theft or vandalism, from assault to felony murder, crimes containing an element of racial or religious bias, offenses involving ethnicity or nationality or gender identity, sexual orientation, criminal justice community reports a startling increase. Now, 2 members of the UALR criminal justice faculty have been awarded a federal grant to study anti-Muslim activity in our state. Both have researched and written extensively on hate crimes of all forms. Joining us now, Dr. Tusty Ten-Bensel and Dr. Robert Lytle. Doctors, thank you very much for being with us. Dr. Ten-Bensel, we'll begin with you. The extent, are we able to quantify the extent of anything in Arkansas that might fit under the rubric of hate crimes?
Sure. So it's difficult to understand the extent, the frequency of these types of crimes occurring in Arkansas, simply because we don't really have a mechanism of collecting that data. Now, the police departments do report it to the FBI. However, because we didn't have hate crime legislation on the books, it was very difficult to gauge when something was a hate crime. So our hope through this project is to shine light on these experiences, but also to understand the gravity of what is happening in our state.
Well, there is a common thing, correct me if I'm wrong, but there is a kind of common theme in hate crimes of all forms. If the same psychology or pathology is at work, is it not, in, say, an anti-Muslim crime as it would be an anti-gay or anti-transgender offense?
Yeah, it is targeting a specific group or a classification of groups. And usually the motivation is hate or bias against, either a racial group, a religious group, sexual orientation or gender identity and so forth.
Yeah, Dr. Lytle, your take.
I think what Tusty said is pretty spot on too. I think one of the things to keep in mind is that there's a lot of reasons why that may motivate people to target individual groups, but ultimately at the end of the day, that is the common theme for all of these, is that a group of people are being targeted because of their association or their membership within one of these groups.
Well, there is, in terms of quantifying hate crimes, is there not also, so we read, a reluctance on the part of many victims to report it?
Yes, victims often will shrug off these types of experiences. They will be scared to report it for further victimization. We see this among all different types of groups, from Muslims to LGBTQ and so forth. They either don't know that there are people willing to help, or they don't know where the resources are, or they're just scared to report it.
Well, how much help is there available as a practical matter?
Yeah, so usually, if you experience a hate crime, you want to report it to the police. The problem with hate crimes specifically is that for it to be classified as a hate crime, you have to be able to prove offender motivation. And so that is often pretty difficult to do. And so that, also I feel like discourages people to report and look at resources. But other than reporting it to the police, there's really not much more to that. Now, I know that the federal government federal agencies have now been putting out grants to help these types of programmings come about. I actually just saw one yesterday. And so that gives me hope that there is going to be more resources in the community for these types of crimes and experiences.
Oh, Dr. Lytle, let me go to you. How receptive typically, can we know how receptive law enforcement agencies are now in terms of dealing with hate crimes?
Sure, absolutely. Some very preliminary research that we've done, so I'm not really reporting findings on this quite yet, but the early takes that we're seeing is that police officers, especially in a state like Arkansas that didn't until very recently have a statewide definition, they just relied on the FBI definition for what a hate crime is. Police departments in particular were just they have to treat these crimes like any other crime. If it is a hate crime, they can send it to the FBI. But when it comes to like training and things like that, for the most part, these kind of get lumped in with other crimes Same thing with victim services as well, right? If you don't have a definition for hate crimes, you don't have hate crime specific victim services, or at least it's harder to garner that.
Well, let me ask both of you, is there a tendency, because we are dealing with crimes that affect and are reported by, if they are reported, ethnic, religious, cultural, social, sexual minorities. Is there a tendency to marginalize these offenses? Dr. Lytle, we'll start with you. All right, whomever.
Yeah, no, Bob, go ahead.
Well, so I guess what do you mean when you say marginalize the offenses?
Well, I mean, in the sense of marginalizing, to not to minimize the factor of hate as a compelling element in the offense. Yeah,
well, and some of what Tusti talked about earlier about the complicated nature of proving a hate crime, and really hate crimes aren't really considered to be hate crimes officially until the prosecution charges the offense as a hate crime. So it gets a little bit strange when it comes to how people can identify whether or not this is a hate crime or not. That being said, I think that there is some sense of that when they're investigating. And I do think from, again, the very early takes that we've had, that police departments generally take those crimes very seriously, but they're trying to treat them as they would other crimes that they also would try to take very seriously. But we haven't really talked so much about crimes that are not violence, right? Things that are more vandalism or things that are more harassment or things like that. And those aren't really covered so much under this new hate crime bill either. So there may be something going on there. We aren't quite as sure yet there. Now, I believe, and Tusti can correct me on this if I'm wrong, existing research does suggest that sometimes police officers do kind of have a less intense response, I guess, to some of these types of crimes, and especially if hate crime groups, if the groups they're being targeted are maybe certain types of groups. Like we know that when it comes to like homeless communities, sometimes those individuals can kind of get overlooked because there's so many other things that are going on. All right,
the grant, let me ask specifically about the grant that you've just received, the two of you, to study anti-Muslim activity in Arkansas. How are you going to go about doing this? We do not have that many mosques, right? And our Islamic community is not the largest in Arkansas.
No, so there's actually a number of projects that are part of this larger project. So the first year we will be doing face-to-face one-on-one interviews with Muslim members in the community to kind of really understand what their experiences are in depth. In year 2, we plan on sending out a survey to the larger Muslim community in Arkansas based on the responses that we get in the interview. And then year 3, we are planning on talking to police officers to see how they handle hate crime situations, what kind of training that they receive, what kind of training they think that they still need. And then we're also going to be talking to hopefully legislators to see what kind of obstacles that they ran into in passing, for example, the class protection bill, what kind of obstacles or what kind of resources they need to keep moving forward.
Well, the political obstacles in the session of the General Assembly just concluded were obviously formidable because the hate crimes bill that the Hutchinson administration for which it has long advocated, and it has some other advocates, fell, and a substitute piece of legislation was adopted. Dr. Lytle, we'll begin with you. Your thoughts on that?
On the bill that was passed, it was, to me, a first step. The way I study policy a lot, and the way that I talk about this with my students is, most policy with complicated political issues like this, it's a conversation. And to me, this is the beginning of the conversation as far as the policy goes. I believe that we will probably not stop at this bill. At some point, we'll need to keep adjusting it and improving it. And hopefully projects like the one that Dr. Tim Bensel and I are working on will kind of help inform some of those decisions moving forward. But some of those things that stuck out to me, and that make me think of this as kind of a first step, is the attention to serious and violent offenses. We do know that, people from many of these different communities that typically are protected by hate crime bills, they tend to experience a wide range of offending. But there's also, the definitions of the groups that that qualify for a hate crime. And I think those will probably also eventually kind of get more focused in, if nothing else, just because logistically it's hard to implement a policy that's vague or ambiguous like that.
Yeah, I wish we could go on, and I promise we will at a future date, but for the moment, we're simply out of time. Dr. Ten Bensel, Dr. Lytle, thank you very much for your time. Thank you for coming on. Interesting discussion. And as always, we thank you for watching. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.